You know, one of the great things about minimally invasive cosmetic facial surgery now is injectable fillers. They've made a huge difference on our practice, and we use them in lips, in wrinkles, in tear troughs, in cheeks, and all over the head and neck. But sometimes filler gets in places where you don't want it. We're going to look at a patient who was injected at another office, and he has overaccumulation of purlane in his left cheek, and we're going to inject this today with LIPORASE to dissolve that unwanted filler. So what we're using is Vitrace, which comes in a 1 ml and 200 units of hyaluronidase, so it's Vitrace brand. Inject that by itself, but this is a large area, and so we need a carrier vehicle, so we're going to inject another cc of normal saline. You could just as easily use local anesthesia. To smile, because real big, because it really accentuates this egg-shaped accumulation, and this is just overfill. And one of the nice things about hyaluronic acid fillers is we have the ability, you can relax now, to dissolve that. So we're going to use a 32 gauge needle, and the important thing about this is you have to inject this in the area where the filler is, if that makes sense, because it's obviously not going to work unless it comes in contact with the filler. And generally in the cheeks, the filler is multi-layered. When I do cheek filler, I do deep, intermediate, and superficial injections. So you won't hurt anything with the hyaluronidase. It's very safe medication, but again, you want this to be distributed where you think the filler is. So this is how we do this. This should work in a matter of hours, or for sure overnight. It's an enzyme that hydrolyzes the hyaluronic acid filler. And for LoveThatFace.com, this is Dr. Joe Nyamtu showing you how we make filler go away if we don't want it.